Hello and welcome to my channel. Today I go talk about routine blood tests. Routine blood tests be blood tests where they important that everybody they take them from time to time. They get other blood tests as well where doctor fit add on to request blood tests. Say like if somebody go see doctor and they know well and doctor won't look out for something or won't check something or won't make sure say that they make the right diagnosis, him fit request for blood tests and he fit add on the request blood test or he may add some part of it to whatever test he won't do. Okay, so is it okay for the patient to take the initiative, ask for routine blood tests as well so that everything can be done in one go. Okay, so if you ask the doctor, I don't see any reason why he go say no. He no go do them for you. Okay, especially if you're an adult. Okay, so make the initiative and ask. Okay, routine blood tests they're important with or without any illness. Okay, so even if you don't get anything, still request for it. You don't have to wait for you to get ill before you do it. Our body they like engine, so this body needs to be fueled. Okay, this body needs to be oiled, just like you the oil engine, the fuel engine, to make sure the car they on the road. Make sure you they do tests, look after your body so that you can live longer. Okay, so for people where they take medication, it's very important for them to they do blood tests, and these blood tests they within the routine blood test as well. Okay, to do this blood test they important because you gonna know what's in the happen inside you and you gonna know about your overall well-being. Okay, and this blood test will help you as well to make an informed decision about your body and lifestyle. So I'm going to be talking about the blood tests where they're important that you do. And routine blood tests be a name, but it gets so many blood tests within it. Okay, so I go start with the first one, kidney function. Okay, now kidney function tests, they measure the level of waste products. Then they call creatinine, where they're for the blood. Kidneys, okay, they clean the blood, they remove toxins, and they transform them to waste. And they come out in form of urine. That is when you say you dey wee. Yeah. Now, kidneys they remove all the medications where they for our body. They balance the water where they for our body. They release hormones and they regulate blood pressure. Okay. Kidneys also they produce an active form of vitamin D where they promote strong bones. Okay. Now, if you look on my screen, you will see the symptoms and signs of kidney problems. Okay, so if you get any of those things, please go to the doctor. Okay, I beg, no wait, just go. Now blood test they go do and they go find out what's there wrong with you. At least if you not get anything, it's good. If you get something, at least you can get early treatment and not wait for it to get worse before they go detect them. So kidney function tests, they're very important that everybody they do them. Okay, now within this kidney function tests, they get within that they call urea and electrolytes. Okay, these be minerals where they inside the body. Okay, now the urea and electrolytes be minerals where they inside the body. Okay, you dey hear about sodium, you dey hear about potassium, magnesium, chloride, and you dey hear about zinc. Okay, and many others. Okay, they help to maintain water where they inside our body. If they get any changes to the level of electrolytes, if it cause various causes, okay, like dehydration, diabetes. Okay, so the next one where I go talk about now be the liver function test. All the blood where they come out for our belly and intestines, they pass through the liver. The liver they process blood, they break them down. Okay, they balance and create nutrients. This same liver they metabolize all the medication where we they take, okay? And they make them easier, okay, for it to come off from our body. Okay, so liver basically they filter, they digest, they metabolize, they detoxify. Okay, basically liver they clean the blood. Okay, we no fit live without liver. Okay, but we they possible that we go live with part of the liver. So if the liver spoil or it damage, yeah, it go release a substance called enzymes in the blood. Okay, they make the levels of protein produced by the liver to drop. So it's important that they measure the levels of enzymes and proteins. Okay, otherwise it can lead to diagnosis of liver conditions such as hepatitis, cirrhosis of the liver, liver scarring, okay, and alcohol-related diseases. So it's very important that, we check them all the time, okay? We take medication, so the person when they take medication for a long time needs to do liver tests. It's very important, okay? So people when they diagnose themselves, they self-medicate. Don't forget to take your liver test, especially if doctor know they monitor you and you've taken it for a very long time. So my next test is the lipid profile test, okay? When they hear about cholesterol, when they hear things like, say, cholesterol, they high, you dey low, you dey this, you dey that, okay? Okay, and if they get high cholesterol, if it cause an increased risk of problems like heart attack and stroke, okay? Now, they get good cholesterol and bad cholesterol. The good cholesterol be the HDL, where they remove harmful substances, and it help the liver to break down these things into waste. Now, the bad cholesterol, which they call LDL, they cause plaque, where they develop in arteries, increasing risk of heart disease. Okay, so it is very important that we do all these things tests. We not overlook them. Okay, now the next test I want to talk about here, where they're very important, is the thyroid test. Okay, thyroid test. Thyroid there for neck. Okay, so if they produce and they react to certain hormones. Okay, thyroid be a gland where there for our neck. Okay, so it help regulate the body functions. Make our body they function well. Okay, sometimes we find ourselves, I say, we get different moods. It affect our moods, it affect our energy and overall metabolism. Okay, if thyroid they're abnormal, if it indicate conditions where they're like low protein levels, thyroid growth disorder, okay, then you'll get abnormal levels of hormones like the testosterone and the estrogen. Now, the next test what I want to talk about is sugar level. Then they call them blood glucose. Okay, blood glucose test be what they call sugar, what they for blood. Okay, and then they take them they diagnose diabetes. Okay, then they take them, they monitor people who get diabetes, and then they take them, they diagnose diabetes. So if somebody glucose they high, doctor fit tell them, say, make they go do the glucose tolerance test. Okay, that test, now 2 tests in one go. So you go do the first one, you go fast go, do the first one, then they go give you a sugar drink to take, and then they go bring you back, do another blood test again. So when they do that one, if they're high, then they go do the HbA1c. They all come under sugar tests, okay? Now that HbA1c, then they take to diagnose diabetes for everybody, okay? So the HbA1c, they cover your sugar level for the last 3 months. So that one, they give them accurate picture of what they happen, and then they will diagnose you. Okay, so it is important, say, you watch what you eat, you do your blood test regularly, you monitor yourself as well. So the next one I want to talk about now will be the full blood count test. Okay, now the full blood count will be a hematology test where they assess blood counts, okay, and they look out for abnormalities that might indicate a problem. Okay, now this full blood test fits, and they assess the white blood cells and the red blood cells. Okay, and they include looking at an indication of inflammation. Okay, and then you will look at that inflammation indication where they look at, they call them erythrocyte ESR rate. Okay, now this full blood count where we all talk about, okay, they're very, very important because they provide clues about certain health problems you may have. Okay, this test is used to detect a wide range of disorders like anemia, infection, blood disorder, leukemia, especially if you're having symptoms of fatigue, weakness, inflammation, bruising, and bleeding. So it is very important that somebody do this test. Very, very important too. Okay, so the next test where I want to mention here as well is the nutritional deficiencies of B12 and B6. Okay, so they get symptoms, you don't on the screen now: dizziness, depression, and many others. Okay, high temperature, mood changes. If you get any of these symptoms ready for screen, please make sure you do all these blood tests so that if there's any deficiency, they will give you supplements. Okay, for abroad, and they know they waste time. Once they find them, they will give you supplements immediately, and they go boost them. Okay, like B12, they come in form of injections and tablets. So either one way go work out, it will give you. Okay, supplements there for shops. So if you know, say you get deficiency, doctor will tell you which one you go buy, and then you use it, because it's very important that you get on it. Okay, there are other vitamins as well. So look out for the one where they're low, and then make sure say you take supplement for it. It's very, very important. It's part of the routine blood test. Okay, so what thing I go talk now be say, I won't repeat again. It's because we know say our body, they important that we look after them. Okay, make we always do that. Okay, our kidneys, our liver, they're very important. They are organs in our body. They're very important. Recommended routine blood tests, they're very important. Do it every year, once a year, twice a year. No keep quiet, no overlook them. No take your money, they do so many other things, but they look after yourself. Tomorrow, if anything happen, they go look at other things, and that thing they do them. When? Now because we no look after ourselves. Okay, it's very, very important. I don't think say anybody go say make you no do blood tests. For Africa, you can walk into a lab and do the blood test. Thank you for watching my channel. See you soon.